Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We're going to be talking with Dr. Kendra Outler. She's joining us here as founder of Uzima Health and Wellness to talk about health disparities that she's seen and experienced in major medical centers. Welcome to Health Professional Radio, Dr. K.
Thank you so much. I appreciate the opportunity to speak with you and your audience.
I'm glad that you could take the time with us. Tell us a little bit about yourself briefly and talk about being founder of Uzima Health and Wellness.
Okay, sure. So I am a board-certified anesthesiologist. I work here in the DMV area. As you and I and so many were affected by COVID, and especially with my specialty, we were kind of, that was real, looking at people's airways and trying to decide which patient that we need to take care of and seeing very sick patients. So anesthesia is a critical care specialty. My interest in public health has been long. I have been in public health since I finished Emory School of Public Health in 1995. Mm-hmm. And so I never take off that hat, and so when we had this pandemic, I thought, how can I have a space to comment on everything that's been affected, around me in terms of the stress of being a healthcare professional, what was going on in my hospital, what was going on in the environment. And, of course, major news outlets started discussing health disparities, but that's not a new conversation. Mm-hmm. So in the late 90s, of course, we had our HIV pandemic, HIV epidemic. And, so working with the HIV work in public health that during that time, I remember some of our struggles in terms of messaging, in terms of prevention and community needs assessment. And I just started Uzima, organically to start writing about my thoughts on COVID, our response, and health disparities. So once we started this conversation again, it was very natural to start writing these pieces that it ultimately evolved into a website and my advocacy work with Uzima Health and Wellness. And Uzima means life in Swahili. And so I took that name and ran with it because, the word of the day was Black people are dying. Black people are dying. That was being resonated across the news media. And I thought, how then do we counter message that? How do we continue to have conversations about other healthcare disparity issues that Black communities have always dealt with before the pandemic?
What are some of the disparities that you've experienced in major medical centers? But there's no way that these disparities only exist in the major centers. It has to exist across the board, which the pandemic has shown us.
Yeah, it has. I mean, our major medical centers always get highlighted, okay? I have worked at Grady Hospital in Atlanta. I worked at Cook County, and that's where I trained in anesthesia. I was an ER physician. My first hat was family medicine, and so I've trained in the Texas, Louisiana area. I was in Hurricane Katrina, so I've experienced some major. I've had a tour, as you say. I don't speak on behalf of the military, but I have had the distinguished honor to serve the nation by working at Walter Reed National Military Medical Center. So I've seen these traumas. We are a major medical center for the military. So the disparities, from top to bottom, and you're right, it's across the board. We're all struggling in terms of the burden of mental health, cardiovascular disease, stroke, hypertension, obesity, which we saw with COVID got more attention to the perils of being massively overweight and this understanding that this can contribute to respiratory issues as you get heavier, and if you end up with a disease, it can be very, it could cost you your life in terms of your weight management. We've talked about what's also out here, cancers. We've done better with screening. However, we still struggle in our communities that are underserved, that lack access to newer interventions of treatment and more aggressive treatment. Hence, we end up still having a larger number of African Americans dying of cancers that we think that if they had better access to modern treatments, better encouragement with and partnering with a tertiary care center than like a Georgetown or Johns Hopkins, maybe the outcomes will be different. So those are the major ones. Gun violence and trauma is, as we see it now, is very real. That's a big disparity. And guess what? We have to give more blood. We have to understand that there needs to continue to be blood drives, and there needs to be continued awareness about the perils of gun violence in communities of color that have always suffered from gun violence. So, between gun violence, cancer, obesity, heart disease, mental health, we are still struggling with these numbers in terms of large gaps of poor outcomes for African-American patients from the East Coast to the West Coast, north to south.
We hear lots about the social determinants of health. Do you feel that some of these disparities are bigotry hidden within policy as opposed to blatant bigotry as it was back 40, 50 years ago?
Mm-hmm. Well, Grady Hospital has the history of being called Grady's. And then when you're training there as a resident and you're encountering an old patient and they keep putting up plural, it's not that they have poor grammar. They remember when there was a white ward and a black ward. So we don't have that. We don't have, as you're stating, blatant discrimination when you walk into a healthcare system. But something that I've written about before is that we still put VIP on chart. That means very important person. And that's as blatant as it can be, but it's not blatant right now if you're not looking for symbols of this disparity in terms of how you will be viewed versus somebody else needs to be viewed. So that is a very real. There are hospitals that have distinguished wards. How do you get regulated to a regular bed where you may need to ring your nurses bell numerous times versus another floor in these hospitals that are very fancy, corporate sponsored, and people usually don't know about these nice floors where you have one-to-one patient care to the nurse, back to the doctor immediately, okay? So there are some blatant things that unless you are within the hospital structure, you don't think still exist. But I will say that, of course, we have evolved in terms of the history of medicine in the United States from a system that really perpetuated racism, and policies were formed to say whose life was of more value. Okay, that is a reality that is in the history books, not in the medical books. And if you study the evolution of medicine, which some people have dedicated their lives to. Jim Downs is the most recent author that I can think of who wrote Sick from Freedom, who talked about this, slave medicine and how after the Civil War, what happened and how people were looking for care and wandering through the nation, and then the nation had to grapple with, well, why should I care about this group of freed people anymore because they're not of value to me. And so in a way, until our medical community addresses this kind of ghost and start to examine the policies closely, yes, the social determinants of health will still exist, and there will be policies based on the business side of medicine that continue to perpetuate inequality and drive bad outcomes for Black patients and other patients, underserved communities as well. But I'm speaking as a Black female, so that's why I say that. Mm-hmm.
What kind of education and advocacy work is Uzima currently engaging in to empower Black and, as you say, the other underserved communities to find better health and healthcare outcomes?
So Uzima Health and Wellness is positioning itself to be a outlet for education. We are trying to come and bridge that gap between the culture and medicine and business, and kind of have a multidisciplinary conversation. So we're looking to be, and what I'm forming it to be, is more of an educational resource versus this kind of person leading a influential type of go to me for all the answers. What I want to do is peel back some of the layers of medicine which we are unclear about. Want to make sure we can stimulate conversations culturally, medically, politically, business-wise, so that you can develop an advocacy within your own community. Because what Chicago needs is very different than what Jackson, Mississippi needs is very different from what Houston needs. So we have to put the information out there. We have to kind of update our catalog of how we are looking at medicine, treatments, education, and merge that with our everyday cultural outlets. That's what I'd like to see Uzima positioned to do. Our advocacy work is all about education. And as we peel back certain major diseases, how do you advocate for better food? How do you advocate for better access? How do you advocate against gun violence in your community? And that's what I'm trying to get people to engage with Uzima to find out about.
Give us a website where we can learn more.
The website is MyUzima, MyUzima.org.
Dr. K, I appreciate you joining us here on Health Professional Radio, and I'm looking forward to our next conversation, hoping that you'll return.
I will. Thank you. I'd love to talk more. And again, thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Kendra Outler, also known as Dr. K. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.